Now, I want to actually look at the diagnosis criteria for pelvic inflammatory disease. So, for pelvic inflammatory disease, what are those subtle things that once you see them, you can just confirm that, okay, yeah, somebody actually has a pelvic inflammatory disease. So, well, if you want to diagnose pelvic inflammatory disease, is first of all, the most important aspect is what the patient is complaining about, right? So that's what we say is now clinical aspect. So after the clinical aspect, you already know that it's pelvic inflammatory disease, but you must also still send some 1 or 2 samples to the lab, just to confirm and all of that. So the minimum clinical criteria is treatment should be initiated in sexually active women for risks of sexually transmitted infection if they have these symptoms like cervical motion tenderness, uterine tenderness, adnexal tenderness. Okay, so most of those things you pick them up on probably pelvic examination or so. Then additional supportive criteria: if the person is having fever, so their body temperature is more than 38.3 degrees Celsius, abnormal discharge from the vagina, abnormal discharge from the cervix, of course it should come out through the vagina, or then elevated white blood cell count, elevated erythrocyte sedimentation rate. Okay, then sometimes you send some 1 or 2 samples to the lab, and if they confirm that it is chlamydia trachomatis or necessary gonorrhea. But these criteria here are basically things that you should just know. You understand? If you're in a resource, a place that's a low resource setting, do you understand? You don't have the luxury of labs and all of that, you should still be able to make your diagnosis.